Hi, my name is Deanne Schmucker. I'm a licensed clinical social worker, and I've been working with chronic disease and the management of chronic disease for, well, a really long time. Right now, the number doesn't come to mind, but it's been a really long time. What I want to talk to you today about is the 4 most important aspects of a group medical appointment. The first thing to remember, and if you can't remember anything else about what I tell you, I want you to remember these 4 concepts. The first is that this is a medical appointment. It's not a therapy group, it's not a support group, and it's not a class. It is a medical appointment. It looks like a medical appointment. It also can be supportive. It's very educational, and it's often therapeutic, but first and foremost, it's a medical appointment. The second thing you need to know is that it's physician or provider driven. And what I mean by that is that these are the physician's patients, and the physician needs to look at his or her practice and decide how this best can fit into their practice. And then they need to let the rest of their staff know and get everybody around them on board about what this group is going to do, what the goals are, and what the expected outcomes are. The third thing is that this is as big or small as your imagination. You know, I have done this for 16 years, 16, 17 years now, and I am still surprised that every time I push the boundary on this, and I think certainly something's going to spring back at me and say, no, this is not a good idea, that in fact I have yet to find the boundary in this. And so it's really important to put aside some of the stereotypical ideas and myths that we have about getting a group of people together and what a physician's appointment looks like. The fourth thing that you need to know is that this is one tool. It's a great tool. It does phenomenal work for chronic disease management, but it's one tool. And I challenge everybody else out there to come up with other great tools so that we can better help our patients manage their chronic disease.